Lumbar disc herniation is a condition that involves the low back ache, and it involves the low back region and mostly presents as shooting pain that radiates the lower limb. It is also accompanied by weakness of the lower limbs, uh, accompanied by pins and needles, sensation, and numbness. So it commonly involves the L4, L5, or the L5S1 regions. And the most common level of the vertebral column is the L4, L5S1 region. Peak incidences occurs within the fourth and the fifth decades of life, that is between the 50s and the 40s. In terms of gender disparity, the male to female ratio is 3 to 1, and it occurs due to recurrent torsional strains that lead to tears of the outer annulus, which lead to the herniation of the nucleus pulposus. Now here is the representation of the typical vertebral disc. So here we have a lumbar disc herniation, then here it affects the nerve root, presenting as a compression. Now the causes include repetitive mechanical loading, that is those who do heavy lifting. We have trauma to the back region, obesity, use of tobacco, those who are living a sedentary life, heavy and repetitive weight lifting, and use of machines. So these are the common causes of the lumbar radiculopathy or lumbar disc herniation. I've said that it presents as shooting pain that radiates to the lower limb. It can be bilateral or on one side. So according to the types, we have three types. Number one is the central lumbar disc prolapse, and it is often associated with the back pain only. So if you have the pain is only within the back region, it doesn't radiate to the lower limbs, and less frequently as a protruded disc above the second lumbar vertebra may compress the spinal cord or result in cauda equina syndrome. So this is a diagrammatic representation of what we call the lumbar disc herniation. We have the central lumbar disc herniation. You can see very well how it affects. You can see very well how it affects the central part of the disc. Then we have the posterolateral prolapse. It is also known as the paracentral prolapse, and this is the most common occurring type, and it occurs in 90 to 100% of the people. Commonly it affects the descending nerve roots, that is the L4, L5. Within the L4, L5 region, it affects the L5 nerve roots. So in this case, it affects the nerve roots that exit below the disc. So for instance, here we have the L4, L5 region. Now under the L4, L5 region, the nerve root that exits below is the L5. That's why it affects the nerve root that is the L5 nerve root. And the protrusion is most commonly posterolateral into the vertebral canal, where it may compress the roots of the spinal cord. And this mostly appears as backache with the shooting pain that radiates to the lower limbs. Then we have number three, the lateral prolapse. This is also known as the foraminal or extraforaminal disc prolapse. It affects the exiting or upper nerve roots, e.g. at the L4, L5 region, it affects the L4 nerve roots. So unlike the posterolateral disc prolapse, in the lateral disc prolapse, the L4, L5 region, if it is affected, the nerve root that's affected is the L4, not the L5. may affect the nerve roots above the level of herniation. Most commonly involved nerve root is the L4. So in this case, the most commonly involved nerve root is the L4. As we said, uh, a lumbar disc herniation mostly occurs within the L4, L5 or the L5S1 region. So in the lateral one, it affects the L4 mostly. The most common type of the lumbar disc herniation is the posterolateral. This diagram showing a typical presentation of the lumbar disc herniation. So this is a prolapsed disc. You can see here as it moves, and this is a nerve root that this is a spinal nerve root that exit the spinal through. The clinical features include low back pain, and this low back pain is characterized by repetitive low back pain. So if you have low back pain that doesn't resolves, then it radiates to the glutes or the buttocks. This is what we said. It moves downwards from the back region. It radiates to the glutes and even to the hamstring muscles, the thigh muscles, and even to the legs and the foot. Then it reduces with the rest. So if you take a rest, it will reduce. Then it increases with the flexion, that is forward bending, sitting, straining, and coughing. So uh, in this case, people call for strain. Increase in the intra-abdominal pressure will cause that, will provoke that low back pain that it comes with the lumbar disc herniation. Then we have radiculopathy. Radiculopathy simply means pain that radiates to the lower limbs. Then nerve root compression. So this is a typical example of a person with a lumbar disc herniation. Then here you can see this a prolapsed disc or herniated disc as it affects the nerve roots as they exit. So exercise therapy is one of the main parts or one of the cornerstones of the effective treatment. So number one, we have pelvic tilts. This helps strengthening the abdominal muscles. We have the cat camel exercises to strengthen the back and the abdominal muscles. We have single or double knee to chest exercises. For this, you can start with the single before you progress to the double knee to chest. Then we have the semi sit-ups to strengthen the abdominal muscles. Then trunk flexion exercises to stretch the back, abdominal, and leg muscles. The trunk flex is very important and very effective immediately in reducing the pain. Then we have hip stretch to stretch the hips, the buttocks, and the back muscles. So remember to subscribe, like, and share. Thank you.